Welcome to the 9 News Business Buzz. I'm Ryan Frazier, 9 News business expert. For the last 2 years, artificial intelligence has dominated headlines, mostly focused on chatbots and image generators, but a real AI revolution is happening quietly inside our hospitals and clinics. It is fundamentally changing how doctors diagnose disease, and just as importantly, it is changing the business mechanics of how healthcare is delivered and paid for. Joining me to unpack this is our 9 News medical expert, Dr. Pal Coley. She's also the founder of Cherry Creek Heart, and she is a professor at Duke University and Johns Hopkins University. Dr. Coley, great to have you.
Great to see you, Ryan. Thanks for having me on the show.
We've a long time in the way to get you here, but I'm so glad we finally got the health and medical expert on the Business Buzz to talk about not only medicine and healthcare, but the business side of things. Dr. Coley, let's start with medicine. We hear promises that AI is going to cure everything, but as a practicing cardiologist, where is AI actually showing up in your clinic today? Are you seeing it make a real difference in how we diagnose or treat patients' hearts?
You know, Ryan, I'm seeing a fundamental impact in how I think about conditions, how I treat patients, and even how I predict risk. So I would say the biggest sort of sectors in which AI has really started delivering for us who are practicing at the bedside is first in imaging. So AI is better than us, hands down, in imaging. And there was actually a randomized controlled trial where they took some radiologists and had them look at mammograms, and they took AI with some radiologist supervision and had it look at mammograms, and AI found earlier disease, it found more subtle disease, and it did a better job of just finding other findings as well. So I know for me as a cardiologist, imaging EKGs, which is an electrical map of the heart, it's huge. Now I can look at a single patient's EKG and make a diagnosis. What I can't do is say, how does this patient's EKG compare to the population EKGs, and how are they evolving over time? So what AI is really good at doing, of course, is analyzing that EKG, but also looking at how it fits in the context of the larger population and say, oh, as a population, we're getting more hypertension or high blood pressure based on the EKG. So imaging, it's been huge, and it helps me read my echoes, which are ultrasounds of the heart. But what I really am excited about is looking into the future. So the crystal ball that AI offers, right? So you can take your blood test today, your imaging test today, your family history, your genomics, which we're getting better at, put it all in a pot, and AI will spit out your risk of having a specific disease when you're 80 or 90 years old.
Wow. So things like the predicting heart failure risk?
Heart failure, dementia, cancer, stroke, all the things that are modifiable. And how that helps me is because we know that our risk prediction tools are blunt objects, right? We're just not that good at looking into the future. We're good at looking backwards and looking at the present. And so if AI, which is good at making patterns, says, hey, this is where Ryan Frazier's disease trajectory is headed over the next 30 years, I can say, okay, now I need to work harder on this to change that disease trajectory. It's also, by the way, predicting which medications you might respond to based on your genetics. And so I'm not just picking a medicine randomly out of the air for your high blood pressure. I'm saying, okay, based on your biomarkers, your genetics, your ethnicity, this is a better medical choice for you.
Well, Doc, for what it's worth, I got on my bike this morning. I did some push-ups.
Good.
I made sure to eat right. I'm doing all I can to make sure I make your job a little easier.
So I'm going to put all your information into the AI bot, and it'll say that you're going to be a 100-year-old man.
I hope so, God willing. So I want to pivot to the business side of medicine,
okay,
because the numbers are staggering. Studies show doctors spend 2 hours on paperwork for every 1 hour they spend with a patient, leading to what the industry calls pajama time, where doctors are doing data entry from their living rooms or the bedroom at night. How is AI acting as an operational tool to fix this massive administrative burden?
I mean, this is such a big problem. And not only is it a problem because of pajama time, it's a problem because of the bigger problem of burnout. So we have a high rate of clinician burnout because it used to be our job was just to make the diagnosis and do the treatment. Now we have to do all the paperwork. We have to do all the coding. We have to do all the billing. We have to do what's called chart biopsy, where you take somebody's chart, thousands of pages of records, and try to extract out the information. So just to give you some context, when I'm preparing for a day in the office, I spend about 3 or 4 hours beforehand going through everybody's charts. Then, of course, I spend 3 or 4 hours afterwards finishing the charts, writing the orders, sending the prescriptions. So AI here has made a huge impact. I have myself in my clinic something called an AI scribe. So when I walk into the patient's visit, I get their permission, their consent, because AI is listening. I turn on the recorder, and it listens to the entire conversation, makes a nice summary of exactly what I talked about, and I can just cut and paste that into the chart. Now, the next level of that, of course, is that somebody comes in with 2,000 pages of outside hospital records. I upload those into AI. It reads everything, extracts what's relevant for me. And now what it's working on is, okay, it's not just putting together the clinical information, but hey, Dr. Kohli, you talked about these 5 things. This is how you should build this visit, and these are the codes that you should use.
This is amazing
Yeah.
to see what's happening in healthcare and what's to come. Now, administrative costs eat up a massive 25% of all healthcare spending. A lot of that is friction between hospitals and insurance companies, coding claims and fighting denials and waiting for prior authorizations. In 2026, we are seeing the rise of agentic AI that can actually handle this back and forth automatically. As a practice owner yourself, Dr. Kohli, how critical is this technology to keeping independent clinics financially viable?
You know, I'm a dying breed. I say I'm going extinct because there's very few independent practices left out there because of these administrative costs that you mentioned. And I think it's really important. So I have a full-time person that's just there to do paperwork and billing. So imagine if AI could help reduce some of those administrative burdens and take over that and do it more accurately potentially because they know the rules of every single insurance company. My fear though, I will say this has great promise, but I have a lot of fear about this as well. The fear is that the insurance companies are also using AI and they're using AI to create more denials. So that's actually creating more of a cycle. On the other hand, if there was a physician on the other side of the insurance company looking at something, they would say, of course, this is reasonable. But if it's an AI bot, they're designed to reject. They have a bias introduced into them to reject. So I'm getting a lot more rejections than I ever got before for medications, for procedures that I'm requesting for my patients and what have you. So I worry that it might create a war of the AI bots, essentially, so to speak. And if it does save administrative costs, are we really translating those to patient care? Are we just going to end up putting them towards more overhead or what have you?
Yeah. Now, in the final few seconds we have, Dr. Kohli, if AI is analyzing the ultrasound or drafting the medical chart, the obvious question for patients is, who's double checking the machine? How does the medical community balance the efficiency of AI with the need for human oversight and patient trust?
This is the biggest challenge, I think, moving forward. I think an over-reliance on AI is going to be what gets us in trouble because humans are very afraid to question AI. So I think what we need is more research, what we need is more validation, and we need to make sure that our AI tools don't have bias. And if we have that, I think AI is going to be my best partner in crime.
Yeah, as a fellow business owner, I can say we are definitely taking advantage of AI to be more creative, to be more productive, to be more efficient. But we also know there's a human touch that's going to be needed as well. Dr. Pal Kohli of Cherry Creek Heart, as well as the 9 News medical expert, thanks so much for giving us this look, if you will, behind the curtain. The takeaway is clear. AI isn't replacing your doctor anytime soon, but by taking over the massive administrative burden and streamlining the business of healthcare, it might finally give your doctor more time to focus entirely on you. For the 9 News Business Buzz, for my friend, Dr. Pal Kohli, I'm Ryan Frazier. Have a great week.